All right, today we're here with Dr. Brian Springer from Ortho Carolina, and we had a couple of questions that we thought might be good for our audience to hear some answers to. And one of the questions that we wanted to talk to him about is, when is it the right time to have a hip or knee replacement, Dr. Springer?
Great, thank you. It's a very important question and probably one of the most difficult questions for doctors and patients to answer, which is, when do I finally make the decision to have a joint replacement? And I think the bottom line is that answer to that question is a little bit different for everybody, because when people decide to have a joint replacement depends on several different things. The amount of pain that they have, how much treatment that they've had leading up to the surgery, how effective has that treatment been, and when really is it the right time for them and their family to have surgery. From a physician's standpoint, we obviously like to see that they've been through several attempts at conservative management, whether it be an exercise program, weight loss, cortisone injections, physical therapy, etc., and to make sure that they've attained the benefits that they can from those before deciding to have surgery. Realistically, what makes a decision for patients is when they ultimately decide that the conservative treatments aren't working anymore and the pain that they have is affecting their everyday life, their ability to do their job, their ability to do things around the house, spend time with their family and their friends. And once they really start to see their pain and limitations interfere with their lifestyle, most patients at that time often make the time to have joint replacement surgery.
Dr. Springer, just kind of looking at the other end of surgery, what kinds of activities are safe for patients to do once they've actually had a joint replacement?
Sure. It's a great question. It's a very important question for patients, and it's an evolution. If you look over the past 20 to 30 years of joint replacements, I think in the beginning we restricted patients quite a bit from a lot of their activities, from what they could do. What we've seen over the course of the years, though, is as the technology has gotten better, as joint replacements last longer, as the materials are more durable, and also now that we're doing joint replacements on younger, more active patients, we're expanding the activities that we now allow patients to do. We don't want our patients to feel overly restricted when they have a joint replacement. We want them to be able to do the things that they enjoy. And realistically, our one big restriction for patients at this point in time is we don't like them to do repetitive impact activity, which essentially means repetitive running. And as I tell our patients, it's not so much that we know that it's bad for the joint, it's that we just don't have enough information to know that it's safe to do that long term. Aside from that, we let our patients be very active. Our patients with hip and knee replacements can walk, they can bike, they can do elliptical machines, they can be on a treadmill, they can do stationary bike. We allow them to play doubles, tennis, and golf. We allow our patients that are good skiers to be able to ski and really be very active recreationally.
Dr. Springer, one thing that I think a lot of people are wondering is which is better, or what are the advantages or disadvantages of, after a joint replacement, of rehabbing in an actual rehab at a hospital or rehab center, as opposed to going home and rehabbing at home?
Sure. It's a very important question, a very, very common question that we're asked, is whether or not is it better to be able to go home after joint replacement or to stay in a rehab center. And it's really an individual question for the patient. I would say that the majority of patients after joint replacement surgery are safely able to return home after a short hospital stay and do the majority of their physical therapy and rehabilitation right from their own home. For example, most people stay in the hospital on average 2-3 days after an elective joint replacement. And then we oftentimes make arrangements for a home physical therapist to visit their home. And most people just like to be in the comforts of their own home when they're recovering from surgery. Now, what really makes that decision is really the patient's social support. So we have certain patients that may be elderly, or patients that may live alone, or patients that simply just need that little bit of extra rehabilitation time in order for them to be able to adjust to the environments of being at home. So it really is an individual question that has to be tailored to the specific patients, and there's pluses and minuses of doing both, and I think that's an important discussion to have with your physician prior to surgery so that those arrangements and plans can be detailed before surgery.